So sickle cell disease, when you are sickle cell, it can predispose you to stroke and heart attacks because sicklers usually they break down their red blood cell very often. So there can be plaques accumulation in the blood vessel. Thank you very much. I want us to look at hypertension, the role of hypertension in the cause of sudden unexpected deaths. You know, hypertension occupies the pride of place in the cause of cardiovascular disease and stroke. Everybody has blood pressure. Sometimes I hear, hey, this person has BP. This person has BP. Yes, everybody has BP. Everybody has blood pressure. If you want to qualify it for, then say this person has high blood pressure. Because even babies have BP. So blood pressure, you know, is the pressure generated by the heart. That helps blood to circulate in your system and all that. Now, a normal blood pressure is defined as a systolic over diastolic blood pressure of 120 over 80 averagely. If you want to look at the ranges, the systolic blood pressure measuring 100 to 120 over a diastolic blood pressure measuring 60 to 80. These are the normal values of blood pressure. I am saying this, let me explain a little bit. The heart pumps to supply blood to the body. Now, the pressure which the heart pumps or contracts, it contracts to push blood out. So the pressure that is exerted when the heart contracts is called the systolic blood pressure. Now, after it contracts and push the blood to the system, it will have to relax to refill blood that has been oxygenated by the lungs. So the pressure that it takes to relax to refill blood is called the diastolic pressure. So if you are getting a systolic blood pressure of between 100 and 120, it is normal. And a diastolic pressure of between 60 and 80, it is normal. We have a condition where we term pre-hypertension or borderline hypertension. That is when you get a blood pressure reading of 120 over 80 and 140 over 90. So it's between the normal up to 140 over 90. With that, it means that you need to take caution. You need to take all precautionary measures very well. Now, when somebody is hypertensive or when we diagnose somebody of hypertension, it means that there is a sustained elevated blood pressure of 140 over 90 millimeters of mercury. So when you get your blood pressure reading from 140 over 90 and above consistently, then we are saying you are developing hypertension. Now, when your blood pressure goes high, it means that your heart is overworking, and therefore the blood vessel or the heart can get tired easily. The heart is overworking and the heart can get tired easily and can lead to heart failure or a shorter lifespan. So it's very prudent that we check our blood pressure so that we don't overwork our heart. But this same heart is the organ that is supplying us with the blood and all that we need to survive. Fancy, you should know, hypertension is termed a silent killer. Silent killer. You know why? Because it damages the small blood vessels in the body without giving any warning signs. So in most cases, your blood pressure will be that high, but you may not feel any symptoms. So by the time you experience symptoms like morning headaches, occipital headaches, dizziness, palpitations, tiredness, breathlessness, fainting, and all that, enough damage has occurred in your heart, in your blood vessels, in your eyes, in your kidneys, and all that. So we need to treat hypertension very, very, very well. Let me touch on the causes of hypertension first, then we go to the risk factors. Somebody will ask, what really brings about this hypertension? A majority of the causes of hypertension we do not know. About 90 to 95% of the cause of hypertension, what actually causes hypertension, it is unknown. It's unknown. And that we call it essential hypertension. However, we attribute certain factors known to be associated with the cause of essential hypertension. Some may include, one, the family history I talked about. Some include smoking history, excessive salt intake, excessive cholesterol, blood cholesterol, drug abuse, alcoholism, lack of exercise that I talked about, overweight, stress, anxiety, inadequate sleep. Somebody will ask, how can stress cause hypertension? Stress and anxiety are overwhelming conditions that people are not able to overcome it. When you are overstressed or over anxious, a whole lot of things go on. Excessive stress can cause chronic inflammation. You can get soreness in your system. That is number one. Again, it triggers your nervous system, that's the sympathetic nervous system, to cause something we call a fight or flight reaction. A fight or flight reaction. So it's either you fight the stress or you fly, you run away. So with this response, it initiates release of stress hormones to sustain the system. Stress hormones like cortisol and adrenaline. Now, when adrenaline comes into the system, there is increased heart rate, heart will overpump. There is increased pulse. There is increased even blood sugar because of the cortisol that is being produced. So with the little stress you've gone through, see the things that you'll be going through. And again, stress and anxiety can make you, have unhealthy lifestyle or perform unhealthy lifestyle. Healthy behavior like poor dieting, unhealthy behaviors like physical inactivity. You won't rest, you won't exercise. All you do is you eat. Either you overeat or you won't eat at all. You resort to smoking, alcoholism, and all that. All these things can lead to formation of atherosclerosis, which will bounce back to the cardiovascular stuff we are talking about.